Welcome, everybody, to the Raad Life, the only talk radio show that takes you along with host and age explorer Rod Gantos on his continuing journey of discovery into life's challenges, opportunities, options, and all the latest and greatest things that come with getting older. The Rad Life is brought to you this week by Your Home for a Lifetime, a company dedicated to empowering you to stay safely, independently, and comfortably in your own home. And now here is your host, Rad Gantos.
Hello, everybody. It's Wednesday, March 11th, and the coronavirus scare continues. There's a coronavirus countdown continues. I do want to ask you, Paul. There was an add-on before we went on the air, and it was I couldn't tell from your Irish brogue whether
my thick Irish
brogue, because Paul will do these little sound voiceovers for ads,
right?
And so I couldn't tell whether it was market greater or market greater. Because I was going to ask you if it was like mozzarella.com, would it grate it differently?
No. Market Grader by HubSpot.
Grader with a D.
Yes.
Oh my God!
You can grade your
you realize what just happened, right?
No.
A non-native English speaker just corrected your enunciation. I'm just saying, thank you very much. We're all about diversity around here. Okay, before we start the show, I do want to take a moment. Let's call it a public service announcement, okay? And just allow everybody to know that we do practice safe radio over here. So I'm going to sanitize my hands here. Okay. All right.
There we go.
I appreciate it. He's finally, after 5 years, got the drum roll set right. Okay. We did want to talk about this, and not to make light of it, right? I mean, although I'm guilty of making light of it and issuing memes.
You're kind of snarky about
I'm being snarky about this thing, right? But all that being said, it is serious. I mean, one of the things I put out last week is, I don't know why you're worried, Orange County. I mean, Orange County is so expensive to live in that even the coronavirus can survive here. But I'm bummed. Right? But that being and by the way, I was astounded today when I was doing a little research to prepare for to have Dr. Tehrani here on the show, and thank you for agreeing to come and do this, because I think it's an important thing, especially with the focus being on seniors and your focus and your practice, because they're really the more highly vulnerable with this. Just give you guys an idea, I think it was like 80% of all deaths in China were actually for people over 60. According to statistics.
Exactly.
Yeah, see, Paul is really afraid. When we walked into the studio today, Paul would not shake our hands.
No, fist bumping now.
He wouldn't. He barely fist bumped. Actually, he was a very reluctant fist bumper today.
Social separation.
And then he proceeded to touch everything in the studio that's close to my mouth. I don't understand exactly how that protocol works.
We're going to fog it all later here.
After I talk?
Yes.
Okay. All right. But it is a serious issue, and I think people are really concerned, and we make light of it, but there was a saying I heard one time that all comedy stems from pain and fear and worry.
That's true.
So we as human beings make jokes about stuff that really scare us or worry us. And
you know what scares me, and we'll start this and the doctor can address this, is that we don't know. We don't know.
Well, that's the big.
How long this will last? We don't know the death rate. We don't know the likelihood of it spreading further. We don't know. We don't know.
You know what's interesting about that, Paul? I think is that we talk about this on the show on different topics, where this fear of the not knowing drives a lot of sort of knee-jerk reacting and overreacting maybe, or not reacting enough in the right way. And it goes to a multitude of things. The society, I mean, it's actually interesting because we are dealing with this as a medical scare, but there's a lot of other things that we deal with sort of in a similar way when we don't know. And where do we go to seek information that is dependable, that isn't made to sensationalize? Because, you could argue that a lot of media, regardless which side of the political aisle or whatever motivation it is, whichever channel it is, there's a certain amount of sensationalism. If it doesn't bleed, it doesn't lead. So, are you going to give me the good news or give me the fear news, right? And it tends to be more the fear news, unfortunately. I will also say that it's fascinating how the human condition is, because I read an article yesterday about how influencers are actually using the coronavirus to gain exposure. by doing these little memes where like basically they're wearing masks and they're like
Yeah.
in a hug or a kiss intimate thing, like they're leveraging this thing to increase their influence.
Either stoking it or mocking
Yeah,
it,
and
one or the other.
and I
yeah.
actually kind of have mixed feelings about that. Like is that aiding in relief or is that aiding in more confusion, right? So if you're out there, you might want to just take a minute and understand that this is becoming more and more of a serious thing, and part of the seriousness is the lack of correct information. So with that being
Yes.
said, I really wanted to do a topic to address this timely topic, and I reached out, and I give a shout out to Susan Piperi, who's the head of marketing at what used to be Senior Serve, now it's Meals on Wheels Orange County. So thank you, Susan, for connecting me with Dr. Tehrani. And I reached out to him and I said, "Hey, do you know anybody that would come in and talk about this?" And he said, "I would be more than happy to come in and talk about it." So thank you for coming all the way from outside the Orange Curtain, Long Beach, and coming in to talk about this. So I want to take a minute, just if you'll give people a little bit of background about your practice, your focus, and then you have a particular protocol or approach to your business. So if you would share that with our audience as a starting point.
Yes, good morning, and thank you.
You're good.
And thank you. We met yesterday when we got when I got
On
your
the phone,
phone call.
right,
Yeah,
yeah.
on the phone. I'm Dr. Tehrani.
A little closer there.
Is that anybody? Okay.
Yeah, that's
I'm
Keep
Dr.
your hands away from his mouth.
No. Or his mic, right?
Here's Mike. There you go.
Okay, I'm Dr. Tehrani. A lot of my patients call me Dr. T.
Dr. T.
Yes, some patients have a hard time remembering Dr. Tehrani, so they call me Dr. T, and we make it even easier for them
Is
to
that like
remember
is
it.
that like Mr. T? No, no.
It's more like just don't call me green tea or milk tea, or
Okay.
you could call me sweet tea.
I mean, if
though.
you're going to operate out of the beach, Long Beach,
Right, yeah.
having a name like Dr. T is pretty cool. There's some street creds going on with that name, actually.
I think so. yeah.
I was actually with one of my other patients the other day, and before I even got to say Dr. T, she said Tehrani like Ferrari,
Oh.
and that was new to me.
Oh.
Okay.
It's a win-win. I don't see a problem
I
either way,
don't
right?
either. I'm actually into cars, so that I was surprised I never thought
How
of
did
that.
Dr. T? Just to take a minute, how did that start? Was that something that's been around for a long time, as far as people calling you Dr. T? Is it part of your practice? Were you called that before when you were in medical school, or?
No, it started in practice. It started in practice when people just had a difficult time saying it. They just said, "Can I call you Dr. T?"
Works for me. And so, how long have you been practicing?
I graduated in 2014, and I was a hospital-based doctor for a couple of years, and then I became more of a clinic-based practice in around 2017, going on to 18.
And was your focus seniors from the beginning when you set out?
It was
Okay.
it was seniors from the beginning, and the reason I went into seniors is working in the hospital, discharging seniors. I just felt there is a lack of care moving forward from the hospital. When I was in the hospital and I saw patients come in with strokes or heart attacks, I always thought to myself, well, this could have been prevented
Yeah.
had certain things been done.
Right.
Falls, particularly falls, strokes, heart attacks. I always wanted to get to the root cause of, well, why did you end up with a stroke?
Right.
And as we talked, I kept telling myself, well, this could have been prevented, and that could have been prevented. But
Can I give you one real good example of that? I know I talk about myself too much in my life here, but my father passed
really?
Father passed away a couple of years ago, and before he did, in his 90s, he fell and went into the hospital, and that eventually caused brain contusions, whatever, bleeding and everything. That's what eventually killed him, a fall. He fell in his thing. And it fell pulling something out of the refrigerator, slipped and fell, and that was the end of him. One of the things that shocked me along the way, because he never went home, and he went to the emergency, went in the hospital, and of course, once they stabilized him, they wanted to send him home. I'm like, the guy is in and out of consciousness, but he's stable, and you want to send him home. He lives alone. I can't take him in, and I don't know what to do with him. So we got a little skilled nursing for a little while, and then they said he's not going to improve. We got to send him home. So the urge to keep costs down, you don't stay in the hospital long, you don't stay in these facilities long. They get you out, even though you're not capable of going home
Paul,
and taking care of yourself.
I'll share something just for a personal story. it was about maybe a week or 10 days ago. My father is, and I've mentioned my father here, is like 84 years old. My mom is 79. They live alone. We're fortunate to have, my sister is about 3 miles away. I'm 6 miles away, so close, right? But I receive a call from my mother. I think it was maybe around 11 o'clock or 12 o'clock in the morning. I'm like in North Orange County, Anaheim area. And she says, "Oh, your father fell. He just fell at home."
Yeah. What my dad was doing all the time.
And she doesn't have the body strength to basically lift him. So I reached out, and my sister said she was close by. She went over and helped him. I mean, it could be very simple. And doctor, correct me if I'm wrong, but my impression is that one of the most common issues with seniors is fall.
It is. It's one of the most common cause. It's the number one cause of losing their independence. Is falls. And when let's go back to your father
Yeah.
for a moment. Before your father had a fall, or before your father had a fall,
Fall,
Right.
did we go over medications that may cause falls? Was that something that was discussed? Was fall precautions discussed with you and your family?
Probably neither.
Before?
No.
Um,
And my father over the previous year was falling more and more.
Right. So
And there was no process or procedure. Nobody was particularly interested. His main physician said, "Please stop, because I don't know what this will lead to. I can handle cancer. I can handle heart attacks. My dad had a stroke a few years before, but he said, when you fall, you just mess things up. I don't know what to do."
So I mean, I think a lot of the medical infrastructure and industry, if you will, has sort of a deal with it after versus preventive approach, right? I mean, would you say that's somewhat
or
common?
deal with
in
the
this country?
acute
Yeah.
problem. When he falls, we'll handle it. But then,
But
don't talk
I
to
think
us.
I think in general there's that. So let's talk about this specifically, because I think it's a very critical thing when it comes to discussions on seniors, is this propensity for fall, which could be really damaging, and it's really very prevalent. So what, from your perspective, did you see when you saw this, for example, could be done as a preventive measure?
well, one of the number one causes of falls is medications. So going over your medications with the patient, because if you're on too much blood pressure medications, if you stand up, you feel dizzy and you can fall.
Mm-hmm.
If your blood pressure medications is too much, your reflexes are not that strong. So whereas you were gonna fall, you're gonna fall and you can catch yourself with your reflexes. If your reflexes are weak, you're going to
You're at a
to fall.
disadvantage, yeah.
So when you look at a lot of older adults, they are still on the same medications they were back when they were working. And so when you're working, you're under a lot of tension, and your blood pressure goes up as a result, and you're put on blood pressure meds. But as you get older and now you're retired, you're no longer under tension. You're actually receiving a pension. So you're not stressed anymore. So your blood pressure naturally goes down. Then when you take these blood pressure meds, it even drops it even lower. And so when you stand up, gravity pulls the blood down. There's not enough to get to your mind, to your brain, so you feel dizzy and you fall. These are common causes of falls. Interactions of medications are prevention. There's just not a lot of prevention education on TV. I haven't even seen anything about falls on TV.
Nothing. And it's fascinating, because there sure is a heck of a lot about erectile dysfunction. And sure as I have a lot about reverse mortgages.
Right.
So it's definitely very much a part of the population that is targeted with advertising.
And let me give you
But
another
not fall, or to be honest, not anything that's preventive.
No.
Like, there's no prevention thing. I mean, the closest, I think, but it's not necessarily senior focused, is like when Kaiser does this sort of like Thrive, or like there's a little bit from the insurance companies, which is like sort of like preventive wellness kind of thing. But that's all. You're right. I have not seen any of that at all.
And let me give you another preventive thing that I tried to implement, but unsuccessfully. And it was only after I pushed to get some more information about this. So as my father aged, he's now in his late 80s and going into 90s, he started dragging his feet more. Apparently that's a common thing. I noticed myself even a little bit in my 60s doing a little more. He didn't lift anymore. He was a little weaker, he was a little rusher, whatever, and he would start dragging his feet. If he's dragging his feet, any little bump on the way would take him down. anything that any little tiny 1 inch, half-inch obstacle would trip him up. And so I was trying to work with him to physically become conscious of this and lift your feet. But he wouldn't. He would, and then he would get frustrated. So as he became weaker and harder to do it, he would reach for things, and then he's way over his feet and more apt to fall.
We have my dad going in with a personal trainer at 24 hours twice a week to do some sort of strengthening, and it has helped. But again, he also is bending over. His eyes are down; they're not up. He doesn't place his cane for support in the right place in front of him. He puts it too close to him. And anything as simple as a transition change like even on a handicap ramp where there's a slight texture change or whatever on the flooring, he could lean forward, lean back. But to your point, doctor, a few months ago, he actually was hospitalized for exactly that. It turned out that his medication cocktail basically was completely all over the place. And they eliminated 2 of the 3 medications of the 7 that he was basically on, and it is not very common. What you described is the case, and yet people are just oblivious to it. And to add to the complexity, I know I finally was willing to try, not blood pressure but cholesterol medication. Right? Finally, I was like, okay, fine, I'll try it for 6 months. But what fascinated me is the fact that I get calls, not only calls, text messages, okay, from drugstores. I'm going to leave the name out, right? That is basically telling me that I have it badgers you. You have a refill. Say yes to get a refill filled.
Come get more.
Or the fact that, we already filled it, or you only have 1 left, or you don't have any, contact your doctor. I mean, so if you're a senior and you have a little bit of, difficulty in basically relating or staying up on stuff, right? If a drugstore is constantly telling you, hey, we have a refill for you, come get it. We have a refill for you, come get it. And the prescription was done 6 years ago or 5 years ago, whatever it is, right? And nobody took the care to basically adjust it like you're proposing. It's very common that you could find yourself in that situation. And to your point, that medication now is actually being detrimental to my health versus beneficial to my health.
That's why we educate our patients, understand every medication, why you take it. That's why we educate our patients. Every medication you take, understand why you're taking it. Understand what you're putting in your mouth. Now, your father had a fall, and your father had a fall. One of the second most common causes of falls are throw rugs.
Yep.
Have they
Area
educated?
rugs.
I don't see anything about of securing throw rugs on the floor. You hear about Life Alert, but that's, everyone hears about that.
After I've fallen.
After I fall. But what about removing throw rugs?
So
that's one of the most common causes of falls because the end sticks up.
Right.
And people fall over that.
So instead of the ad saying, I have fallen and I can't get up, the ad should say, I didn't fall and this is why.
Right. Exactly.
Right, exactly.
But I guess I can't sell product doing that. But no, to your point, and we didn't have a chance to talk about this. I'm a certified aging in place. I've been certified aging in place since 2008. Okay, I do commercial interior design, hospitality. So doing ADA compliancy at a high-end application for hotels, resorts, we've been doing that since '91. So I went to school in '91, learned even more about it, and then ended up practicing since '94. So I will tell you, when I went to get a certified aging in place, which is what you're talking about, like, modifying people's homes so they can stay in them longer, healthier, the way that people live right now, they're healthier by nature, although they have some chronic issues going on, but they can maintain independence longer. The homes and residences that they're living in are not necessarily built to accommodate them as they get older. There are things that they can do. They don't want to move. They want to be in a familiar environment. All these things that make sense to stay in your home. Plus, you're appreciating value, and if you're in Southern California, you're selling your home that you bought for, God knows what, like $400,000. Now it's $1.5 million or $2 million, and you're going to basically, the real estate market says sell that because you should move to a smaller one, and then you go, okay, great, I'll sold it. Now what? Oh darn, the smaller one costs $1.5 million, right? So if I can find it, right? So there's a lot of things that motivate actually people to stay in their homes, but one of the things, absolutely, is area rugs. And I used to write for a column called Inside Elder Care, and we used to tell people, like with their holidays, If you've got multi-generationals coming into your house, things of that nature, right? If you have area rugs, that is the first thing you need to roll out and put away,
Right.
right? And if you have transition height differences from your entrance, whatever, you can actually rent ramps for that duration that somebody's coming over. And we're coming on Mother's Day, we're coming on Easter. This is stuff that happens every year. But to your point, there's no national campaign that has high visibility, whether it is a PSA or actually product driven, that actually pushes this, because it's a topic nobody wants to talk about. I'll tell you, from 2008 till almost a year ago, nobody wanted to talk about aging in California, because nobody gets old in California. We don't take salt and put it on driveways in winter. We don't deal with change. Seasons, we don't do seasons. Winter clothes, summer clothes, nobody does change, right? So to go approach somebody and basically say, hey, you're getting older, you want to stay in your house, so let's deal with this remodel that you're talking about, but do it in a manner that gives you
or change your meds, or change your habits,
or change your habits. Right. And yet, I think I was told 40% or 50% of the population in Orange County by 2045 will be 65 and older, right? To your point, they're not working, they're retired, so there's no payroll taxes that are coming into these municipalities. They're buying less, so there's less retail taxes coming into these municipalities. You have an increasing population of aging. You as a municipality has to provide services, otherwise somebody's going to vote you out of office next time around, right?
Right.
So where is the infrastructure that is being put together with a preventive approach? Because that would, from my perspective, preventive means less cost. If I can get people to understand, you and I talked about the importance of immunity relevant to coronavirus, right? It's like this is an opportunity to educate people toward the importance of raising immunity and keeping your immunity up, right, under normal conditions, or so you can weather this better if things come along. But there isn't that kind of approach. And so when we don't do that, we find ourselves in a situation like this,
where we're reactive instead of proactive. So give
us.
I
mean, it's a perfect. Paul is a perfect example. Now, a lot of people think Paul talks a lot on this show, which he does, right? Okay, and many,
old.
well, that's no excuse. Okay, because age is just a number, and
excuse for anything.
And I read an article about a 71-year-old woman that skateboarded. So no, that's not an excuse, right? But the thing about Paul is that he doesn't understand this. I have been using him for 5 years. I really have. Yeah. I've been using him as a poster chart for baby boomers.
I'm the poster chart. I'm everything that's
He's
good
basically
and bad.
my laboratory,
I'm his lab rat.
Lab rat. I basically bring people in, we talk about stuff, and we use him as a thing. And he's a good sport. He will basically go along with this. When we walked in, right, I mean, I've never seen him this panicked. Like last week, he wasn't this panicked, right? and he's like, okay, don't touch this. Here's this thing over whatever.
I am. Yeah.
Right? And so he's a perfect example of people reacting to the unknowing. So with that being said, are you facing that in your practice with what's going on here with seniors? Are they walking in basically
and give us some
concerned?
knowing.
Are
give
you
us some
seeing
knowledge.
some of that reflecting in your daily practice?
We've been very actively promoting, be alert, but don't be anxious. And
That's a good way to put it.
And so that take all that energy instead of being anxious, put all that energy into being alert and protecting yourself. And that's what we've been promoting. For a minute, I want to step back, and this will tie us into coronavirus.
Sure.
But you brought up a point where your father was hospitalized, and then from there he went to a nursing home, and you may have felt that you may have perceived that he was rushed out.
Paul did, yeah.
Yes, right.
So we have to also, this is one area I just want to touch real quick. Where is the sickest place in the world? Is the hospital. Mm-hmm. Second is the nursing home. So we are always faced with benefits and risks. Mm-hmm. We're always assessing risks, and we're always weighing risks and benefits.
That's life.
Right. And if we feel in a hospital, even though someone is still not where they need to be, if they are not improving, then the risk of them being in the hospital is greater than the benefits.
Right.
And so that's when we move to the next step. Just because you left a hospital or a nursing home does not mean your care is over. It just means that you met your set of goals, your short-term goals, And now you're going to the next step to meet the next set of goals. So sometimes I do discharge patients from the hospital because I feel they've benefited the most they can.
It's the best they can
But
get.
if they stay longer, now they're being exposed to things such as coronavirus. And this will lead us into to discussing coronavirus. So there are people that come in for a hip surgery in the hospital, and then sometimes they don't leave because they caught their neighbor's pneumonia, and now they have now they're intubated from a really bad pneumonia, for example. So there are nosocomial infections, and that's something you acquire in a hospital. So as physicians, we always have to make a decision. Is the benefit of them being in the hospital outweigh the risks? And the risks are catching a hospital-based or a nursing home-based infection. In the hospital, there's constantly new patients coming in with new infections, in the nursing home as well. So that feeling perceived that you're being rushed out, it's the back end of it. The back end of it is, what if we kept the person there and then they developed a pneumonia, their neighbor's pneumonia? Then how do you answer to that and say, hey, the family can come to you and say, well, what was the reason that you kept them there this long? What benefit was there that now, had they not been there, they would not have caught that?
Well, and I want to just take a minute here to add this sort of reflection. I think it's interesting because when you have somebody in that situation and you're a family member, that family member of yours that's basically been checked in and is at their hospital, you're looking at that situation as being a stressful emotional situation. So you're looking for what could go wrong, basically. And then when they're basically in that situation, if they were discharged early, I think it plays into the medical system is all insurance driven, and people are being discharged because of the cost, and everybody's in it for the money and all this stuff. But you raise a very interesting point, doctor. I don't think I've ever heard it raised, and it absolutely is valid. Is it actually better to keep them there at what would appear to be more care, when in fact they've gotten as much benefit as they can from that particular setting, and they really should be put in a different situation so that their risk isn't increasing in terms of risk and benefit analysis, right? That's a very interesting thing. I don't think I've ever heard anybody put it that way, and it definitely makes you stop and think that your knee-jerk reaction to basically flail against the medical profession as basically a discharge-happy situation, there might be another side of the story. So thanks for sharing that.
No, of course. And most of the time now, how insurances work with hospitals, it's based on what we call DRG. So the insurance pays for the hospital stay, but it's not per day. It's for that length of stay.
Yeah.
It's get the patient better and get the patient out, regardless of how many days they're in the hospital. It's a one lump sum. It's a one lump sum payment. Nothing is worse than to discharge a patient early and then they have a complication at home and then they get readmitted.
Well, there's actually, isn't the current regulations or
There's a
laws
penalty,
on the books
yeah,
that there's
right.
a penalty to the hospital in those cases now?
Right, and it's becoming more and more.
Readmission.
Right, so we are beginning to focus on readmissions. We are beginning to focus on discharging when the time is right. But also, we always have to consider that the hospital, there is infections going out. Your nurse, as much as they clean their hands and gown up going from one patient to the next, things do get carried. So every day we have to ask ourselves, is being in the hospital, the risk of being in the hospital greater than the benefit? And
Right.
as long as the benefits are greater, we continue it. But that moment where you feel the patient is not benefiting anymore,
Right.
and again, just because you go home or you go to a nursing home or you go home does not mean your care has stopped. It just means
It has transitioned to a
it has
different form.
transitioned to a different
Go ahead,
form.
Paul.
I don't disagree with anything you both have said. All valid points, all worth considering. Let me give you one other piece to confuse it even worse, though. and it's really
No, we're here to dispel confusion.
And it's
so-
really what
Yeah.
prompted my jumping in and offering it, because you said too often there wasn't a long-term plan or something like that. I think that's the problem. There is a short-term plan to get them in and out of the hospital, and then to a skilled nursing facility, and then when they're stable, send them home. but they're not ready to go home.
But you see, Paul.
But the point is, so that my dad had, for example, not to be too graphic, but in the nursing home, he developed a huge bed sore, like 2 inches wide by an inch or two deep. And there was no way he could treat that or take care of it at home by himself or anybody. And yet, because it had stabilized and that was something different, he couldn't stay there any longer. Maybe it was a risk to stay there because he developed it there by staying there and laying there. So I had to fight to get him into a long-term wound care facility, of which there were few. And they just kept pushing him along, saying, when I say, well, what's my option? What's my treatment? What's my plan? And they'd say, I don't know.
Let's give people
Let's
give people a little perspective on when that was, Paul, because again, it's not yesterday.
No, it's
When
about
was
3
this?
years ago. Yeah, 3 or 4 years ago.
So again, I think
I don't think there's a long-term plan to take care of seniors. I think they deal with short-term. You fell.
well,
is the problem in this.
you're asking a question: is there a long-term plan to care for seniors? And I would pose that question to the doctor because I mean, I would think
Foremost.
I'm sitting on the periphery, but I would say that there's been a lot of more raised awareness in the last few years. There's been a lot more engagement from the industry as far as whether it's the concierge service side of it or the actual, Medicare side of it, AARP. I mean, there's been a more increase, driven by the fact that the numbers are getting bigger, right? Would you say that there is an effective long-term plan for caring for seniors, or is it still being worked out?
Seems crisis to crisis. To
Hold
me.
on a second, Paul.
I think there is, but the community has no idea about it. It's kind of like your credit card gives you all these benefits, but you're not using it because you're not aware of it. Like if your credit card offers you AAA,
Yeah.
and you have AAA as well,
You're
now
so
you have
right.
double coverage. So there is services, but there's a lack of knowledge of what services there are. So for example, again, like when your father was discharged, it's not just about, you have to consider when we consider discharge, we also have to, in our mind, consider next steps. So I have to ask myself, your father has a pretty bad wound, a stage 3 or 4 wound, for example. Part of the risk and benefits I have to consider in my head is the risk of going home. What is that risk? Does he have the adequate support at home? Can someone help him at home?
Right.
And if he doesn't have those, then the risk of discharge is greater than the benefit. So
Right.
we keep the patient there.
Right.
But there are services such as there are wound care doctors that will come to your home and provide wound care.
Absolutely.
There is wound care nurses that will come out. But if you don't know how to maneuver the system
Right.
and no one is guiding you,
Right.
how will you know to use these?
And
this
that
is-
was my point. So at each
So
step,
it's not a lack of there being a long-term plan, Paul. It's or services, and we've talked about this over the last 5 years. It's the fact, and this is why we do the show on occasion with a very 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 focus on seniors, is to highlight these services. I mean, how many people actually know that there is an adult? I'm going to get this wrong. Adult daycare health center that is operated by Meals on Wheels. People don't know.
very little.
Very little know. The services available and support through the Council on Aging.
but
Very little people know.
I don't disagree with you, but again, having been there at that moment, this is a major hospital. It's Eisenhower Hospital out in the Palm Desert, considered the best in the area, and a top-ranked skilled nursing facility. At each step, they would simply say, "You got to go," and I'd say, "Well, how do we handle this?" And they'd say, "I don't know, but figure it out." And I said, "Well, give me." They don't give you a list of services. These are the people doing the discharge, the social workers, the doctors, the hospital administrators. They just say, "All we've done what we can."
Paul, it's
You're now going.
got to be more than 3 years what you're talking about, because I've known you for 5, and you.
Well, yeah, it was 7. He died.
7 years, right? Okay, come on. Okay, no,
2013
and the
he
reason
died.
why I'm saying that
I don't know that it's gotten better, but it was horrible. The lack of information. They wouldn't give you any options. They'd say you just got to go.
Yeah, I understand that, but here's what I want to be careful with, because a lot has changed in 7 years.
I hope so, because it was.
Well,
horrible.
no, it has, and my point is we can talk about that being the situation, but let's keep it in perspective that today there's maybe more information out there to be had. At the end of the day, it's still the responsibility of the person to educate themselves. We are trying to educate people through the show by highlighting certain things, but at the end of the day, you got to go follow that, right? I mean, information today is available on on. I mean, I see the word baby boomer pop up more today on a normal feed of news than I saw 4 years ago. Right, so there's definitely an increase in population of seniors, support services, walk-in tubs, all of this stuff, reverse mortgages. I mean, Tom Selleck is selling reverse mortgages, right? There's definitely more of a focus. But to your point, Paul, is that there needs to be more in educating people when they need that information, and possibly from hospitals discuss measures. What I wanted to get with with Dr. T here is he saw a need when he was in the hospital side of things, and so when his private practice, he's been trying to provide that, right? And so let's talk a little bit about your protocol of how you approach your provision of service, like your medical service.
We just because there's such a lack, and even the best hospitals, they talk about what amazing knee surgery program, what amazing hip surgery program
Right.
they have, but you never hear what amazing preventative care they have.
It's not the
Exactly.
business
So,
they're in.
so right,
Or post-operative care that they give. Or
right. You
whatever.
hear about all the post, but what about the pre or the preventative?
Right.
You don't hear that, and that's what our office provides. Each one of our patients they have health coaches, and basically our clinic, we just hold their hand and guide them through every step from preventative care to if they have had an illness. We guide them because we know all the resources out there, and we know that they don't know.
Right.
So we just guide them through every step, kind of like a travel agent tells you what's
A
where.
health coach.
Right. So we have these health coaches that help guide the patients every step of the way. That yes, you are being, because a lot of times when it comes to discharge, a lot of people do feel, oh my God, what is the next step?
I'm
And
not
they
ready.
don't know their next step.
Yeah.
But when you guide them and say, okay, the next step is going to be you're going to go home and you're going
on
to
a second, Paul.
continue
That's what we needed.
the
That's what we
treatment.
needed. Yeah.
And we're going to have home health come out to you, and we're going to have the wound MDs come out to you, and then I'm going to see you in a week to make sure that this and that. Then they feel comfortable and confident. When patients feel they're being let go too fast, it's because they don't know the next step.
Right,
and they
it's the fear of the unknown.
Exactly.
And I will
Exactly.
support, Paul, what you were saying. In the last couple of years, I've been dealing with more of that kind of stuff with my parents, and the information is there, but you have to ask the questions, and you have to ask them multiple times before you get it. It's not easily available without you having to seek it out. So you're right, Paul. It's still not as clear as it should be.
not at
But
all.
there are people like Dr. T here that are actually providing a stopgap, if you will, to maybe get it to be better.
And what I was interested in is a plan, because another point that struck me as odd and difficult to deal with is he goes into the hospital. Now it's not his physician who's just his, who is his oncologist or his heart doctor. They're a consultant maybe, but they're no longer in charge of the case. There's a doctor in the hospital who decides when to go home or whatnot. There's a doctor in the nursing facility, and he doesn't know my dad from anybody here, but he's making those decisions.
So why didn't you have a plan in advance of the need?
Well, obviously we never thought about it.
Aha.
Right.
So we didn't plan for it.
But stop. Hold on.
But they also didn't offer us any options.
Paul, but hold on.
Because all they were there is to take care of the immediate situation.
I want to get past the blame. Yeah. Okay, I want to get past the blame because we do a lot of this blame, right? At the end of the day, you don't go to the financial planner after you basically are bleeding money out of your bank
You
account.
lost the house, right?
Right?
Yeah.
You don't go to the financial planner after you lost the house and say, what do I do now? Okay, you have a plan prior to the fact that this thing happened. That's called preventative, right? I mean, that's what it is. When it comes to this, and you're still talking from the same tone.
No,
I mean, you and I talk about how.
Well, I'm trying to come back around because I think I would have appreciated had there been a Dr. T in his life who said, let's create a plan, let's instigate a plan. Here's some possible things to do in a plan. He had specialists. He had an oncologist. He had a heart doctor. He didn't have anybody with a plan.
Okay, I'm not picking on Paul, but he is, like I said, the poster child for baby boomers.
Yeah, but
so
there
I'm
was
gonna
no plan offered.
Hold on, but I'm going to put you on the spot. Okay, for 5 years on this show, he's grinning. He knows what's coming, right? For 5 years on this show, we have tackled everything from hospice to end of life.
Yes.
To prevent it. Hold on. Don't step away from the mic. I'm not done with you yet. Okay.
away from the mic.
Step away from the mic. Okay. We have brought in people. We have talked about things. Okay. importance of health, exercise, wellness, diet, all of this stuff, right? Okay. How much of this have you put into practice?
None of it.
Okay, thank you very much. Sit back in your chair. Okay, all right. So my point is this, everybody who's listening, you got to take an active role. I mean, people like Dr. T are there to help and to provide that guidance, but you got to take an active role in your health. If you don't care enough about your health to have a preventive plan in advance, then when you're faced by that dilemma, like we are today, like if you haven't been, using sanitizing wipes in your home, if you haven't been washing your hands, if you don't have a well regimented hygiene program that you just follow, right? If you don't eat healthy, right? If you don't sleep enough, if you don't drink enough water, right? All of a sudden you're faced by a dilemma and you're like, oh my God, what do I do? I'm going to go buy all the toilet paper I can at Costco. I mean, that's not gonna, that's a placebo effect.
It's lack of knowledge. Like,
but it's knowledge you don't want, doctor. That's my point. Is when it comes to something like this, okay, we also don't want to think worst case conditions. And very few people are. My mother is one of them. Worst case scenario. If I plan for the worst case scenario, then I'm covered, right? There's not a lot of people that actually seek out worst case scenario and prepare for it, right?
Right, but there's also that lack that it's if you don't know, you can be only as prepared as much as you think you know. For example,
exactly, you don't know where to go to even start the conversation.
For example, like people tell me, I've never been to, for example, Italy, and I shouldn't go there now. But people
probably
tell
not a
me
good
you
idea.
have no idea what you're missing out, and I really don't because I've never been there.
Right.
So, for example, in Paul's case, all that should have been done is Paul's PCP should have called the hospital doctor and gave the hospital doctor a little bit of background. Then the hospital doctor would do what he has to do. Then upon discharge, the hospital doctor will call Paul's dad's PCP and say, hey, this is what the patient came in for. Right. This is what we did, and these are the next steps. And it's that handoff. It's that transition of care that everything falls apart.
Exactly. How often does that happen?
Well, with us, it's all the time. Our health coaches know where our patients is because we always tell our patients, if you end up in the hospital, if you end up here, call us. The health coach then informs me. I call the hospital that they're at, and we have a communication. Like, there has to always be that exchange of communication so that so that you know what's going on. When I was a hospital doctor and someone just walks into the hospital, I don't know anything about that person.
Can I give you one? I got to give you one example on that point because what he's saying is 100% spot on. I'm thrilled he exists. I hope there are more people listening and that will move to places like Dr. T.
Okay,
because here's an example of what he's talking about. So my father is getting ready to leave the hospital, and I ask, I see the physician who's in the hospital, who you only get to see him once a day, and you better be there when he's 5 minutes when he walks through the room because you won't see him the rest of the day. He's not going to come back. Sorry. And so I got him there. My dad's physician comes in later, and and he says to me, so what did the doctor tell you? I said, what did the doctor tell me? Don't you talk to him? No, I haven't talked to him. He hadn't communicated. The two of them had not communicated. He's asking me to recall in a 5-minute conference at 8 in the morning what the physician on call had told me.
Okay, so
that's ridiculous.
So Paul
wrong.
Paul has just painted the whole medical profession 7 years ago with this particular
I think
example.
it's still the same way. I think Dr. T's of the world are changing it, but I think the system is still set up that way.
So you think it's the same way?
I suspect it is.
Okay, based on your own experience from 7 years ago, not a recent experience. I'm not saying it's.
I agree.
Okay,
I have no proof of that statement.
So hold on. So now that the topic's on the table, I'm going to ask Dr. T. He is offering an alternative from probably what's happening. How common is what Paul described going on right now?
Unfortunately, very.
Okay.
It's still very common. You as the patient has a choice. If you feel your hospitalist, who's supposed to be the chief in charge, is not providing you the information you need, or you're not comfortable, you have the right to say, I want someone else to provide I want someone else. You have a right to be informed because if you're not informed, how are you going to make informed decisions? Right. Just because the doctor came in and left. Now, it's the whole system is tough. But there are times I myself have to run in and out of the patient's room, but I will reach out to the family and I will call the family and say, hey, do you have any questions? You too It's you too can call the doctor's office and say, "Hey, I want to talk to the doctor when the doctor has a few minutes. I want to see what's going on with my dad." It's our job. We've collected money from you to see your dad.
Right.
It's our job to call
So
you
it
back.
really is a partnership, and the expectations is that you're basically going to be spoon-fed stuff without asking is a little unrealistic. And at the same time,
Yeah, but I wasn't asking for that. And he's listen to what he just said. though.
I know, Paul, but
It
I'm trying
happens
to.
too often that
I
where the
understand, but
hospital
I'm
physician
trying to move
is
on.
not communicating.
I'm trying to
with the
move
doctor.
on to the current situation of what we want to talk about
I
today.
know.
Okay, and we keep falling back into this thing, and we keep falling back into it like it's happened yesterday. And I want to keep it in perspective. Yes, it is still ongoing. It really comes down to the personality and the care, the pride in how you do your job. If you are a physician that is basically has that, empathy and sense of desire to go that extra step and provide that information, then that patient and their family is very lucky to have you as their provider. At the same token, to sit back and expect to basically be given everything without even engaging in the asking for the information, I'm not saying Paul did not, okay? Unfortunately, he maybe did not get what he needed when he did ask. That is also something that you have to engage in. You cannot just sit back and not basically seek the information and expect that it be given to you, because that physician, that hospital is doing other things to care for your patient. And so you might have to stop them for a minute and say, "Hey, I appreciate everything you're doing, but could you also give me information on this, because I need to know what the next step is," to
Right.
dispel the fear of the not knowing what the next thing would be.
But it's a
Right.
system that's set up to not
You are part of the
give you
system too.
I was, believe me, I asked, I was active.
Right.
I asked, I was the point person for everything that you're doing. I didn't sit back and expect stuff
Okay,
to
so
be
here we
fed to
are.
me.
We're dealing with coronavirus.
I think the same thing. It's a lack of knowledge. That's what we're getting to, is that people feel afraid when they don't know what's
Okay,
happening.
Paul, so let me ask you a question.
Yeah.
Because you're sitting in front of this computer. I'm sorry, Dr. T. I'm getting
Yeah.
a little, because I want to bring it back on track.
Well, I do
okay?
too, but-
No, but it's getting off track.
Okay.
So let me bring it back on track. I'm going to ask you. You sit in this place. You get a lot of people that come in and talk about all kinds of different things. I'm sure that we're not the first person to talk about coronavirus in here.
One of the first,
in the last week. Okay. Okay, well, that's unfortunate. Okay. Secondly, you're basically it's an online-based thing, so you're in front of the computer. You have access to information. You're constantly sending me things that are basically relevant to different things on different topics we talk about.
Right.
What is coronavirus, Paul?
Coronavirus is apparently a novel virus. It's one they haven't seen before, and I guess it must be somewhere in the flu family or something, or it has something to do with a flu-like symptom. But because it's new, we don't have an immunity built up to it. Nobody does, and it's unknown how far it spreads, how fast it spreads, and all that stuff. They don't have
How
enough
accurate
data.
is that evaluation, Doctor?
Well, I'll get to that in 1 second,
Yeah.
but just to step back 1 second, it's teamwork. We all have to be
Yes.
very proactive.
exactly what I'm
and
saying.
I always tell my patients, if you call me and I don't get back to you within 24 hours, it's not that I was ignoring you or I didn't mean to. Sometimes we get distracted. We're humans. Things happen. So I always tell my patients, follow up with me in 24 hours. Follow up. So we have to all be very proactive. And just be, and if we're not getting our answers we want, take it to a higher level. Speak with administration and say, I'm just not comfortable or confident or whatever it is. Because ultimately you have to feel comfortable, and we're all trying to make it work.
But I don't know, to Paul's point, I don't know that we, as non-professionals, know what that comfort is. Like, what are my expectations when I'm basically receiving this care? I don't even know what the results of my care should be. I mean, I'm being cared for. I have no idea how much the healing time period is going to be. I don't know what to expect next. So I completely agree with you that
We should try to answer your question so that when you leave that day, you don't have questions wandering in your head. We should try to answer your questions to the best of our ability so that you don't feel a void in you, because you're already dealing with someone sick.
Right.
The least we can do is, before you leave, make you feel at least have your questions answered.
So what is coronavirus?
So coronavirus in general, it's an old virus that usually affects children or animals. But there are strains of it that come and affect humans. There's been in the past 6 other strains, and now we've had a new strain that's been twisted a little bit, and a new strain of it has come out in 2019 called the COVID-19. This is the 7th strain that has affected humans. Why COVID-19? CO for coronavirus, VI for virus, D for disease, and 19 for the year was discovered. It was discovered in December 2019. So this is the newest virus that's out. There is...
But we've experienced other strains of this
of
basic
coronavirus.
virus.
Right.
And we were talking about this before the show, and some people may know, like SARS, which was, I think, like 2014, 2004 or something, and then we had MERS, that was like 2014, I think we found out. So we've had strains of this, Paul. It's just that this particular strain
is
new since 2019.
And is it in the flu family?
It's not. The flu family is the influenza family. This is so it's a different virus family than the flu family. Because they're both viruses, you're going to have overlapping symptoms. You are going to have overlapping because they're both viruses. But
so what are some of the symptoms?
The symptoms are cough, shortness of breath, dry cough, shortness of breath, fever. Those are the common symptoms that you may have. But I think more than just the data, because it's such a new virus, there is no clear black and white answers to it, and every day things are changing. It's like if it's not black or white, it's gray, and there's 50 shades of gray. And by 50 shades of gray, I mean there's 50 different opinions. This morning I hear in the U.S. 1,000 people now have been infected with it, and 30 something have or somewhat have died from it in the U.S. Then on the CDC website, I see it only says 647 people. So how is the CDC, who's supposed to be the best, not aware of the other 300 something? Or so the data is all over. Everyone has an opinion. I don't know if on Instagram you saw that at some point there was a dress that is it blue, is it green? Like everyone had a different opinion. It's the same thing with this coronavirus. Everyone is going to have their opinion, and that's just a lot of noise. In my opinion, let's look at the facts and put all that energy into protecting ourselves. And what are some of the facts? The fact of this coronavirus is that it's highly contagious. And look at the coronavirus and look at it in 2 ways. There is the virus, which exists in droplets, and then look at yourself. So how this droplet, if it gets into me, I get infected. So where does this droplet live? This virus inside of a droplet can live in an infected person, or it can live out in the community on some kind of surface. It lives for a few hours. Why do I say few? Because we don't know. Is it 2 hours, 3 hours, 6 hours? When we look at its close cousins, probably around 5-6 hours is the life of how long it lives out in the community on a surface. So.
And that comes from you sneeze or you breathe or you touch the surface.
How is it transmitted?
So if I have that virus in me, I can expose it to the community by sneezing or by coughing. That's how it comes out from me and it goes into the community.
Breathing, being proximity.
Not so much breathing, exhaling, it doesn't. And again, there's nothing known, but we do know that if you can expose it by coughing it or by sneezing. Those are
about touching, because we're all afraid to touch each other now.
So it's just if you just imagine if you cough in your hand, now the virus is in your hand.
Yeah.
Right.
If you cough and on the table, now the virus is on the table.
Right.
So that's why we say.
But it's not perspiration.
And then a lot of people who may be coughing out of courtesy will put their hand to their mouth, and so now you got it on your hand.
So now the virus is on your hand. Yeah. So what's the next step? You go and you shake hands with someone. Now that person took that virus and handed it to the next person.
They touched their face or anything.
Now the virus is not going to get absorbed through your hands.
Right.
This person, there's only 3 ways that we know that this virus can really get into you now. One is through your mouth, one is through your nose, and one is through your eyes. So if you have the virus in your hand, well, don't put it in your mouth, don't put it on your eyes, don't inhale it.
Yeah.
So this is why we say wash hands, so you can get rid of the virus. we say don't be in crowded of reduce the being in crowded places, because if someone sneezes on you, you may inhale it. But just taking these simple things of don't get it on your hands by hugging, by touching things, and if you do, wash your hands to get rid of the virus, because it's pretty simple. The virus is just, it's out in the community, and if you touch it and you bring it onto yourself, then you caught the virus. So that's why
there's a lot of things that are simple that you can do to try to minimize the risk,
reduce the risk,
and still be able to proceed in a normal fashion with your daily life. And so when you put it that way, it's manageable.
Very. It's
versus this panic that we are dealing with now, where it's like, I'm going to get it from touch, I'm going to get it from whatever. Again, you should be washing your hands. You should be maintaining sort of a courteous form of hygiene, especially for people around you. You shouldn't be out in public if you're basically not feeling well. You shouldn't be basically coughing on people. There are certain things you should be doing under normal conditions anyway.
Right. The only thing that we're doing that I've taught my patients to do a little bit differently now with this is don't hug, don't shake hands. Say hi like this, wave, whatever. Where did waving hi go? Just avoid that contact.
Well, fist bump will still do the same thing.
Yeah, fist bump can transfer it. So don't fist.
That's the same thing.
Because the idea is you don't touch your fist to your nose or something. You tend
but you're still carrying it.
Yeah.
Right. So you want to reduce your chances. So fist bump, it can still transfer from one to the other. But just wave hi. Some people are nowadays, they're bumping their foot high.
Right.
Just, be careful you don't fall doing that.
So can I ask you
I had somebody actually refuse to bump feet with me because they were wearing a new pair of shoes. So
let me ask you a couple other questions that have come up here at the station as people have talked about this. All right, so it is something we've seen before, but it's a new strain. It seems to be a virulent strain. It seems to get absorbed quickly if you come in contact with it. It is contagious. Is it like SARS, which burned out? I know we don't know this. Do we suspect it's like SARS, that once it ran through the population, it was gone, it did not reappear? Or is this something that will reappear over and over again?
I think like a lot of the other viruses, it's just we have to get it contained.
Right.
It's difficult to eradicate viruses. That's why we can't get rid of the HIV virus. Viruses are constantly changing, and they're very hard to eradicate. That's why we can't get rid of the influenza virus, because they're extremely hard to eradicate.
Right,
we just have to contain them, and it's always a battle between us and the other bugs. The other bugs being bacteria or viruses. We just have to always we're always learning and growing, because the virus is always becoming resistant. They're always changing, and we always have to change accordingly to be able to fight them back.
Well, and doctor, I'll tell you, like I got at the beginning of this year, I had I was about 2 or 3 days of basically coughing, and it didn't feel exactly like a flu, but I felt off, and I went in and I got basically a test, and lo and behold, it was influenza. It was A+. And
you had a bad one, yeah.
I was told basically to quarantine for about 5 days, and I did. And the interesting thing is that was way before this, right? So when I see what's happening, and I realize that we under normal conditions are faced with things like flu, with influenza, with things of that nature that cause us to actually adjust our behavior.
Right.
But I'll tell you something, over the 5 days, like before I basically quarantined myself, I didn't go basically build myself a fortress out of toilet paper, right? Or basically buy all the Perel that I could find. I mean, I bought wipe pads, I bought a couple of masks in case I needed to go and do something. But there was a manageable way to deal with this and see it through. I think the thing that's interesting about this is, again, it's the unknowing, but there's also where do I go for dependable information? When you were saying it, the CDC's website is in conflict with somebody else. Here comes a map on one of the radio stations, and then people are passing stuff along like memes with maps. It's like 310 cases in California, and God knows what they're there, and there's map color coding and all this stuff going on. Where do I go to get this information? And to be honest, we live in a world which is information overload. So we under normal conditions, without it being a disease-related thing, we have a hard time figuring out what information is reliable and what is, I hate to use the word, fake news, right? But so we are also victims to this, I think, societal dynamic that we have. But where do we go for actual reliable information? So where should we go for reliable?
Follow me on Facebook,
OC
MedWell
Talk.
Medical.
Perfect. I love this. I pitched it for him and he picked it up, right? So why don't we give people the website, Dr. T, so they can do exactly that? What's the website they can follow you?
It's www.medwellmedical.com or Facebook MedWell Medical. Everyone has talents.
Yeah.
Everyone has talents. I think it's amazing what you guys are doing. I was actually working with a designer, and I was just so amazed by how they see things there when it's not there. I call that hallucination. There,
We call it
hallucinate a lot.
creativity.
right?
We hallucinate a lot.
I felt so, excuse my language, but dumb when he just kind of like moved things a little bit and the whole scene changed. And I thought to myself, wow. Then he asked me a medical question that I thought, oh, really? That was a really dumb question.
Yeah.
So it goes to show like we
We'll have our own strengths.
all talented. And my personal talent is I'm good at being able to express a medical education as easy as possible, as
For a layman to basically
right
understand.
to understand. And I have a lot of patients that come to me and just say, by you just explaining how the virus is on the table and now it's on my hand, and now that I understand, I can do it. Whereas if someone just tells me wash your hands for 20 seconds, what is that? If you don't understand it, you don't do it. But if it makes logical sense in your head, you do it. And I think you just have to explain things to people to a point where they understand it, and then they'll do it. If they don't understand it, they won't do it.
Well, because people are really actually normally, and this is no difference, they're really hungry for that. They're hungry
They
for
wanna know
that
the truth,
clarity,
yeah,
right?
right,
They want to know, even if it's not necessarily good news, they want to know what is real and how they can basically either adjust to it or how they can basically mitigate it. And this happens to be no difference with this topic. The
Right.
hype and the reality.
And that goes again to shades of gray. It goes into, is this green? Is this blue? Everyone has because the answers are not black and white clear, everyone has an opinion, and someone may come and tell me, Dr. Tehrani, you were wrong. The virus can get absorbed through the hand and the skin. And, in 2 days, we may realize that it can. But in my opinion right now, it does not. So
With what we know.
with what we know, and again, it's just a lot of it is opinion. So take what you know and follow what you believe. But in my opinion, always it's be alert, but just don't be so anxious.
I'm Paul. Before you jump in,
Yeah.
I found myself doing something this week that I have not done in probably at least 40 years,
What's that?
if I've even done it. Okay. So people who know me know, or they've been listening, I've shared that I actually grew up like in Kuwait. I was born in Baghdad, grew up in Kuwait. There was a period where we were actually, my dad's a civil engineer, or was a civil engineer. We were on a construction site, or construction camp in Abu Dhabi when there was absolutely nothing in Abu Dhabi. It was all sand, and we would wash everything. I mean, they would disinfect floors. We would wash vegetables and fruits. We didn't just buy the thing off the grocery store shelf and then basically just continue, proceed to ingest it and bite into it. I found myself actually washing apples just quickly to make sure that, in case, now the apple was in a plastic bag, it was sealed, but I just washed the apple really quick before I ate it. And I kind of caught myself thinking, why don't I just normally do this? Why am I, is my assumption that that apple has been packaged in that bag is like in a sealed, pristine,
Nobody touched
climatically
it. Yeah,
controlled,
right.
germ-free kind of environment. We live in a world, there's stuff around us all the time, and we joke about the fact that children that are so protected as they grow up develop a very weak immune system that basically later on in life doesn't help them, even though the parents are really looking out for them younger, right? And a lot of things like asthma and allergies and things that are now seem to be more, and it's a combination of the fact that we test for them maybe more, but also that we live in a very, very sanitized environment. And so things like washing something, wiping something down, washing your hands in between things, we kind of veer away from when it's something like this comes back and reminds us that maybe some of this stuff is should be doing on a regular basis, right?
Right, and exactly like we have to evolve, otherwise we're going to stay behind. And yes, like I said earlier, I haven't told my patients to do anything differently. They should already be washing
Right.
hands, and but just there came an era where everyone thought hugging and loving and all this touching, but we need to step back from that, because that is, you are transmitting
Right.
stuff from one person to another.
And
I
you
s-
never, and even without without the coronavirus being out there, you really don't know that person's
right.
and so you take a calculated risk when you get in that close of a personal space with somebody anyway.
Right. So
So do you think
we
any of this will
That's why I
change
don't. That's why I don't hug on.
permanently?
That's why I don't hug Paul ever.
Ever,
but I
never.
still don't understand what this napkin craze is all about.
I,
Why?
I don't know.
I don't know either. Like why people are.
What is
if,
it? I
if
don't
there's,
even
if
know what
there's
it
a
is.
comment section and people are commenting, like someone, maybe we're missing something.
Well, we only have a few minutes, but I do want to put the number out, Paul, for people just in case they have questions and they've been listening. What's the number they can call?
949-888-94. I'm sorry, giving you a different number. 949-330-7761. 949-330-7761. Operator standing by.
If you have any questions for Dr. T, please give us a call if
last
you've been
couple of
listening.
minutes,
And I will add one more skill set to you, Doctor, is the fact that you can mitigate between me and Paul. So that, I don't know that that's going to
calmed-
carry any
calmed
weight
us
if you
down
post
I'll
it.
put it on my resume.
You put it on your resume, but hey, there you go.
You calmed us down. I have two questions for you.
No, it is a contentious topic to a certain extent, because the unknowing means that I have an opinion, you have an opinion.
Right.
And we can't come to a certain place where we have information that's factual that we can
Exactly.
agree on what those should be. And so we basically, no, that's not what it is. No, I'm not going to bump your fist. No, I'm not going to touch your foot with my foot, with shoe to shoe. Well, yes, you should. That's rude. Why aren't you so we don't know. So
here's my two questions.
yeah.
And this is one of the things nobody knows, so just an opinion. The CDC weighed in today what they thought. Will it get worse before it gets better? Or have we already passed
What do you
the
think,
worst?
Doctor?
I think we still have the peak left.
We still haven't reached the peak.
That's what the CDC
Do you think
said
part?
today.
You think part of that though is the fact that it's getting worse or peaking, or is it because we haven't really been doing testing? Because that's the other thing too, right? We keep seeing the numbers go up, but are those numbers that are new cases, or are those numbers that are being discovered through testing? Now that testing
Or
is
both.
becoming more frequent.
We have no idea what the denominator is. We have no idea how many people have it. A lot of people are coughing and they're not getting tested. They may have it and we don't know. I don't. I mean, I hope it doesn't get a lot worse.
Yeah.
But
These are just
it is
opinions, yeah,
a new virus, and I worry about our senior population, because they just don't have that army, that soldiers in them to fight it off.
The immunity.
The immunity.
So next question is, Rad's father's 84, obviously has some health issues, or his
Yeah.
mother has some health issues. Would you advise them just to be on precaution and to stay home and minimize travel, contact?
What is your advice to seniors? Because we've talked about from the beginning that this is a virus that is going to have and has had a stronger impact on that population, on anybody over 60, for example, right? So especially if they're in bad health or they have chronic illness. So Let's talk a little bit about that, about who are people that are vulnerable, and then what do you advise for those people to do?
The people that are vulnerable are the ones with just reduced immune systems that can't fight it back. And that, in general, there are young, healthy people. There are young,
Right.
healthy people that got it too. But we're focusing on the common things. And one thing I've learned as a young person is common things are common. If you think rare, you'll rarely be right. If you think common, you'll commonly
That's
be
good.
right. So I don't want to make the perception that no young, healthy person cannot get infected. Yes, you can, and it can, but it's much rarer. But it
So you can also be a carrier.
they can definitely be carriers,
Right.
but our immune system is so strong that it's holding it at bay.
Right.
But in older adults, they are at the biggest risks because their immune system are the lowest, and they just have a hard time fighting it back. Older adults, people with multiple comorbidities, like in Italy, when you look at I think there's about 10,000 cases in Italy right now that they said. Why? In general, Italy has an older population than us, than the U.S., so they have a much higher older population. And also, Italians smoke more, so they have
Respiratory
more.
problems.
Yeah, they have more lung conditions, and that makes them weak. That makes the lung weaker, so that it can't fight the bug as strong. So if you're so what I would advise older adults are just take precaution. Don't go somewhere that you may catch the bug, because again, the bug is floating. It's you getting it and,
Right.
and inoculating it in yourself. So just don't go out around in crowded places for now until we get this bug more contained. Wash your hands in case the bug is on your hand. You wash it off. Don't touch, if you haven't washed your hands, don't touch your eyes, mouth, or nose, because if it is on your hand, you
You're
will
gonna
now
ingest it.
you're going to ingest. Yeah, you're going to take it in.
What are some things that people can do? Again, we said that this is an opportunity for us to also re-emphasize the importance of a strong immune system. I mean, for any age, really, but even for seniors, right? What are some things that, from your practice, what are some of the things that people can do to help strengthen their immune system?
Help
under
to
normal
take shots of
conditions, like,
vitamin C and
so
all
that
this
they
stuff
maybe,
here.
when something unprepared for comes around, that they are in better health, for example.
It's unfortunate. You see a lot of stuff on Instagram. Oh, this will boost your immune system. There's nothing really shown to boost immune systems that are research shown and proven to do. Exercise if you can. That boosts your immune system. I tell, again, there's no evidence behind this, but it worked for me and a few friends, so I tell my patients to do it. Take vitamin C and cranberry juice if you can, and that will help boost your immune system a little bit. But has any of this stuff been proven? It hasn't. None of these probiotics or other things you hear out in the market.
Echinacea, all that stuff.
None of them has been proven that they boost your immune system. Just, stay healthy and
So one more
take
question.
precaution.
Let's say I'm 64, so I worry. I get it. And let's assume that, like everybody over, that my immune system's not what it used to be here for whatever reasons. Maybe I don't get enough exercise.
You notice
or eat
how
right.
he felt? He said that with a sense of entitlement. I'm 64, so I worry.
No, it is. I
Get
do.
over it. I worry.
So if somebody contracts the disease that's a senior, is there anything you can do to shorten it, to fight it, to ensure that it doesn't go into pneumonia? That's what we're afraid of, is that I'm going to get this and there's nothing I can do. I'm either going to get pneumonia or I'm not going to get pneumonia, depending on my underlying immune system. And there's nothing I can do to boost my immune system. So too late to suddenly make up for a life where I didn't eat well or exercise well or something. Is there anything I can do if I catch it to mitigate it, to fight it, or to shorten it?
So you may not really be able to boost your immune system, but you can prevent it from getting worse. And so if you're a smoker, stop smoking. If you have comorbidities, like your heart failure is not controlled, your blood pressure is not controlled, get those under better control. Because just because you're here, you could get even, your immune system could even be lower. So make sure it doesn't go lower by managing your comorbidities. Make sure you're on the right inhalers. If you're taking inhaled medications, make sure you're on the right inhalers. What happens is you get infected with one virus, and that reduces your immune system, and then the other bugs come
You're
and join
more
the party.
susceptible, yeah.
So reduce your chances of getting another infection. It's
But if you suddenly found yourself, let's say you got, I say tomorrow they found that I got it. Should I go out and exercise? What can I do in short term? It's too late to balance out all these things. I got it now. Is there something I can do at that moment, or is it just ride it out?
I would say seek medical attention very quickly as soon as you.
But they're not going to give you anything. They're going to.
So reduce your chances of being exposed to other to more bugs.
Okay.
Stay home. I would say take deep breaths so that you could kind of like dust off your lungs.
Okay.
Take a little bit of vitamin C and
Should I
cranberry
exercise
juice.
more? Should I try and? I always felt somehow if I get out and exercise more at that moment, it would help clear my lungs or strengthen my lungs, or is it too late for that?
No, if you can. Again, there's no data or research behind any of this, but the more active you are, the stronger your immune system is, and the better it can fight it off.
Right.
But so suddenly dousing yourself with vitamin C. Oh, I see people.
Not-
For example, there's products on the market now that claim that they'll reduce your flu. There's all these products they sell that say if you take this, it has aluminum in it.
What
or
is
something.
the silver bullet instant cure for when I
Well,
basically
yeah.
suffer from the lack of
'cause
what
we're-
I should have been doing in the first
But
place?
we're at that point now where that's
Right.
the fear. It's you can say what we should have done, but here's where we are today,
Don't-
and that's what people are afraid of. They're going to get it today. What can I do today?
Don't dose yourself with vitamin C
Yeah,
or
exactly.
we don't want or vitamin D, or we don't want someone to turn into a stone.
Exactly.
In America always thinks it's, if one is good, 10 must be 10 times
Yeah,
better.
right.
But just moderation.
Right.
When I get sick, for example, I take a vitamin C 1 gram, and following that, one tablet 500 milligrams once a day with a glass of cranberry juice. And of course, if you're diabetic, then drink the diet type. But moderation, and we don't need to go to extreme measures. And me doing this may all be just in my head, but for me it works, and to my friends and patients I've given it, it's worked. Again, it's just, I don't know, it's a Tehrani cocktail, whatever you want to call it.
The Tehrani
But-
cocktail, people.
Cocktail. We're selling those, so I got 3 of them left.
Available at your local juice bar and your friendly bartender.
Well, I think, but I know your Rod's making light of this here, and I should have prepared years ago and gotten ready. But the point is that we're here where we are.
You know,
and
it's
the fear among people my age and older is, if you get it, it might get worse and you might die, and there's nothing you can do except ride it out.
right. And Paul, here's the thing.
That's scary.
But hold on. But you also keep looking for a silver bullet, instantaneous, just add water solution. And I'm saying, okay, fine. Good luck with that. It'll probably work. You could probably mitigate it. But then what always gets forgotten in the heat of the moment is that there's a lesson to be learned here, so that next time around it does not actually, you are not as vulnerable for something. Because guess what? This is
It's a learning
this is number
opportunity.
19
Yeah.
because of 2019.
This is the seventh virus.
Seventh
of the
virus,
coronavirus.
seventh virus.
They
but
discovered
it's
it in 19,
in 2019. So in 2021, you might have a -21, right? And now you're going to go ask me the same question instead of between 20 and 21 with the near miss in 20 and 19. You actually have now changed your habits into exercising. You have stopped smoking. You've basically given yourself a better chance to deal with what may come next.
I think it's both. I think there's a fear right now. What do I do to not get it? And if I do get it, that's our overriding.
And we
fear.
addressed that. We talked about preventive measures
Yeah.
that you could do.
And
Right? And
unfortunately,
if you have it, there is no
there's no way to shorten
cure
it.
for it. But I think if you're going to worry about all these things, then don't go outside, because you
Right.
can get hit by a car. You
Right.
could get so. Just take the same way when we drive, we take precaution. Just take precaution, and if you do catch this bug, remember 80% of people they do well with it. So.
Mm-hmm.
So let's not think worst case scenario, but let's just put our focus and mind into preventing it from getting it. And if you have acquired it, just
Don't spread it.
don't spread it, and
Be
and don't
courteous
try to
enough
catch
to
another person's bug,
Right.
and don't go out to catch someone else's. Do exercise if you can, because that does boost your immune system. and just let it run its course the same way. Influenza can kill. So what do people do when they get the the flu virus? We just kind
People
of
die from the flu virus every year.
What's
Right.
the projected time if you have it? It lasts for a week, for 2 weeks, for a day?
It all depends on your immune
immune
system.
system.
But generally, what are we seeing?
quickly-
Is this, I mean, how long are you going to self-contain yourself? You think you got it or you find you have it? Is it 2 weeks? They seem to be saying 2
Well,
weeks.
if it's the coronavirus, what the CDC recommends is until your cough has subsided and they would and your symptoms have subsided for at least 24 hours and you've done two cheek swabs 24 hours apart and it's negative, then you're considered no longer contagious.
And the normal course that we're seeing, I know that data's coming in. Is it a week? Is it 2 weeks? How long do you
See,
usually?
it's fascinating how you ask these questions, Paul, because you're looking for the quick fix.
Well, but that's what everybody's looking for right now. Nobody's
but
looking
you-
for
but-
next
but-
year's
but
answer.
here's what my
Nobody's
answer-
looking
here's-
for
That's
next
how
year's
rumors
answer.
start, because
Right,
if
right,
I give 7
right,
days, then
right.
everyone's going to expect 7 days.
Well,
Yeah.
well, wait, you said 7, not 8.
Yeah,
Yeah,
right.
not
you
not
said
6, but not 7.
Right, someone's going to
Right.
come and so
It's
it all
called
depends on your
it's called
immunity.
listen to your body. Okay, it's called you cannot control this. You have to go through it if you have it. You
Therein
can do
lies the fear. You
Yeah, but
can't
no,
control
the-
it, and if you
Yeah,
get
but-
it, you
but-
just ride it
But
out.
I don't think it's only fear. I think it's not liking the fact that you actually have to slow down enough, listen to your body, and basically do what you need to do in order not to endanger other people and to give yourself a chance to possibly heal from this. But it is not, people die from the flu every year. Okay, people die from bad hygiene and exposure every year. This is just one thing. It's not exactly parallel, but it reminds me of the fear of the Y2K. Okay, the meltdown due to technology,
Right.
because we're going to turn into the new century, right?
Right.
And oh my God, the hype that went into that. This is actually medical. This is actually affecting people. But the fact that we basically want a quick fix, where do I go? What CVS do I go to and get a Tehrani cocktail? Okay.
The president promised us a fix in 3 months. And
Actually, I think the president promised that if when the weather gets warmer, it's
It
just
was
going to
gonna
kill
go
the
away too,
virus.
So
yeah.
let me ask you
When the
this.
daffodils come up.
How many people did the flu virus kill in America last year?
Paul, how many people?
I know the fact is shocking. It's high.
What do you think?
Oh, I don't know, 1,000, 10,000, something.
So you're just again guessing.
No, I read
the
this
number?
somewhere, and
80,000.
80,000.
That's just in the
80,000.
U.S.
Right.
How many people has the coronavirus killed in the U.S.?
So far, what, 30 or something?
30.
Yeah.
Probably. What about worldwide?
I think it's so we've had 1,000 cases in the U.S. I don't know, 1,000 people.
3,000 something in,
Yeah.
I think. I don't know. I don't
So
know the exact number.
globally, we've had less than half
Well,
of who died from flu in the United States.
So 80,000 died in America.
Right, that's what I mean.
How
Oh my God,
many-
it's not even. Yeah,
How many died worldwide of flu last year?
how many people died of flu?
Take a guess.
1.5 million.
No, that's a lot.
Okay, so okay, well, I don't know. I mean, I don't know. I'll be the first to admit when I don't know something. What
They say up to 650,000.
over
up-
over 500,000 people.
But
died
let me
from
give
the
you the
flu
others. But here's the other.
worldwide, and we've got 3,000 from coronavirus.
I know where you're going.
And we never panicked about the flu last year.
And we don't get vaccines.
And people actually argue for not getting the vaccine.
Right, and people argue against the vaccines. And again, I don't want to get into
Right,
that vaccine thing, but I just think there are other fears out there. Getting into car accidents.
So what is it about this that has made
What is it about
such
this? Yeah.
such a paranoid
It's
reaction?
new, and it is
And it's
very
unknown,
viral,
and it's
it
unknown.
is a little bit more deadly than the flu. But I'm okay with all this talk and with all this noise. The reason why I'm okay with it is because we don't want next year to say flu killed 650,000 people and coronavirus killed another 650,000. It's good that there's a lot of this noise
Raise
right now
awareness.
because hopefully we can contain it, and next year we don't say 650,000 flu, 650,000 coronavirus. We don't want. So it's good that we're being cautious.
We can kill this thing.
I'm right, and I'm hoping next year the flu number of people killed from flu will be even lower. So to me, this is a wake-up call on hygiene, on
Immunity,
Preparedness.
healthy living.
Right.
healthy living. So I think this is
Exercise.
a wake-up call, and I do hope to see a reduction.
Well, let's hope the wake up call actually lasts longer than usually it lasts, which is like 2 seconds
Yeah,
or 14 days.
Now who's being cynical? Yeah,
no.
right.
But I'm being cynical because Dr. Tehrani is absolutely correct. The thing about this is, like, there's also, and you're right about that this is new, this is unknown, right? I just find it fascinating the extent of this kind of panic that's going on, because we don't panic from the flu.
No,
we know
I
it's
don't
there.
panic from driving. How many
we
people
don't
get
panic
killed
from
in-
driving?
how many
Exactly.
people get
We
killed
don't
every year in the
exactly.
car?
So we don't panic about getting on a plane, basically, right? It is a wake up call.
Yeah, it's a wake up call for us to do, and every once in a while we'll have wake up calls.
I mean, we've had things where, and what's fascinating about this particular one is that when you really look at what you can do to prevent or to better protect yourself from basically being exposed, right? Nothing other than don't hug people, maybe, is really out of the ordinary. It's not like where I basically have
to wear a mask or something, right.
like contaminated lettuce, where I got to stop eating lettuce. It's not even that severe. You got to stop drinking water that's contaminated. It's just don't hug.
yeah, just
And wash your hands.
Okay, and we're not saying don't hug forever. It's just don't hug for now.
well,
Maybe we change our hugging.
We're becoming an
procedure.
anti-hugging
we should-
society.
well, just
Yeah,
wave
maybe.
high, or
I'll be
the
curious-
Cambodian people do the namaste.
I'll be curious to see. We're all on pins and needles. Is this really something bad is coming worse, or is this overblown? I look around, I don't see anybody sick, and yet the CDC and others say, but a lot of us are going to get sick. I don't know which reality to believe and fear. And when I get it, there's nothing I can do but ride it out. And a certain percentage, maybe as high as 3%, will die, particularly in my age group. That's frightening. There's nothing I can do, and just ride it out. However,
So once again, we're
when it's all
being driven
gone-
by baby boomers.
when it's
Well,
all gone, well, yeah, because we're the most affected. But when it's all over or said and done, at Rad's cynical point, do we just forget about it and go back to living our lives?
Well, you pretty
as
much
badly?
answered that question by the way you were asking.
No,
Right.
no, I think there might be some changes, just as there have been changes. I'll give you a strange change. Like there was a time when I would have never sorted my trash. That was just stupid. There was a time when I would never wear a seatbelt. That was just stupid. And then slowly but surely we adapted and we changed, and we do now without even thinking about it. I think there could be changes. Maybe we don't shake.
You know
hands
you're
as much.
setting
Maybe
yourself up, right?
No.
You know you're
I'm
setting
saying-
yourself up, right? You're opening up the door.
That's okay.
That in 6 months from now, I'm going to
We
say,
should.
Paul,
Good.
what have you done to change this other than think that you're going to overdose yourself on vitamin C?
I hope that there is a learning, because his point is that we're going to get through this, and when we do, what have we learned to prevent? Because there'll be more of these coming. This isn't the last novel virus that we're going to face in our lifetime here. It mutates, it changes. That's why we can't get rid of the flu, and they can't get rid of these viruses because they mutate. So how prepared are we for these things, and to handle the risk and to handle the
Doctor,
problems?
get the last word.
Last
here.
word.
All you can do is reduce your chances of getting it.
Right.
You cannot prevent it, but all you can do is reduce it. The same way when you're on the road, all you can do is reduce your chance of getting into a bodily
Accident.
injury from putting on your seatbelt, watching
By
your
not
surroundings.
texting while you're driving.
Not texting, but you
Right.
can't completely prevent it. Some jerk may come and hit you. So all you can do is reduce your chances, and the same thing with this virus. Just reduce your chances of getting it, and if you do get it, reduce your chances of it getting worse by controlling your comorbidities. And that's the best you can. That's your fighting chance. There is no cure. All you can do is give it your best fighting chance.
Well, and you can apply that same advice, Doctor, I would guess, to anything.
Exactly. It's no different than
Right?
anything. It's very.
I mean,
logical.
change the word coronavirus or whatever
driving.
to anything, right? It's
Exactly.
and that is being proactive in your health and well-being, to where it's preventive versus I'm going to go overdose myself on vitamin C when I get hit with it. I mean, I tell people for winter, my winter regiment of wellness tends to be, and wellness is becoming a bigger and bigger thing, and permeating every kind of aspect of life. And there's going to be the equivalent of greenwashing, where it's just by word only, and there's stuff that's really meaningful. But I mean, I do a neti pot, I do a eucalyptus spray in the shower. You know, I drink ginger tea in the morning. Especially in winter, I increase that to a more regular thing that I do every day. And we live in an environment where you got pollen, you got dirt, you got stuff that you're basically
Bacteria,
inhaling
viruses,
into your
yeah.
system. And so just cleansing it out in the morning as part of my showering regimen is something that, to your point, I don't know if it works or not, but it works for me.
Right, just being
Proactive in your health.
Reactive. Once the horse has left the barn, it's very difficult. So be proactive, and that's why I love teaching proactive, preventative care, because if you prevent illness, there is no illness to treat. So just be as proactive and preventative as you can. That just reduces your chances as much as possible, and that's my and my job is to really keep my seniors' golden years golden as much as possible. And it's teamwork, and it's just a lot of it has to do with preventative care. And I'm hoping with time goes on, we'll introduce preventative care more and more. We will see a commercial about a rug company saying, make sure the edges of your rugs are sealed to the floor. We don't see any of this stuff, but I'm hoping that we do begin to see stuff on TV that if you're after the age of, or if you're feeling this way, don't be trying to reach for things. I have 75, 80-year-old men still, pulling lemons or, from off trees, and they end up, and all it takes is just one. You don't know which fall is going to be the one. It's like if I drop my phone on the floor, you don't know which drop is gonna
kill your phone.
Which one is
We
gonna
should have him
crack
come
the
back
screen.
and do a show on falling, because I'm telling you, it was the worst thing to watch my mom, my aunt, my dad fall. It was the one thing doctors would just shrug and say, I don't know what I can do to get you to stop falling. And it's your specialty.
Fall prevention. When I was
huge.
on the board of of Rebuilding Together Orange County, fall prevention was a big part of what we
And nobody
tried
ever
to
talks
convey.
about it.
And it really isn't covered. Thank you so much, Doctor. Let's give the website one more time for your practice.
Thank you. It's medwellmedical.com, but I do a lot of posting on my Facebook page, at the MedWell Medical, and I try to always post on things that are new and relevant,
Right.
and try to explain things in a way where you understand. And my hope is if you understand it, then you will apply it. It's not memorization. Do this.
Right.
It's more trying to explain why it leads to what, and if you do this, why it would not lead to that.
Well, and you have actually a video on there that speaks to the coronavirus. You tried to answer some of these questions that we also dealt with here today. And to be honest, it's all about prevention, right? So the number one thing you can do to have that proactiveness and prevention in your life is to tune in every Wednesday between 12 and 1 to the Raad Life. Because you will get all kinds of entertainment. You'll be informed.
We'll fight.
You'll be
we'll
entertained.
Laugh, we'll love.
It's a little bit of a cage match sometimes with Paul, right? You'll always meet interesting people as our guests. And thank you, Doctor, for coming today. I really appreciate this. Sorry to have subjected you to a little bit of this, but hey, we're entertaining at best, right? And it really is important to keep things in perspective and take a proactive role in your health. I mean, at any age, really. And if you're a senior, please reach out to Dr. Tehrani and find out, because, again, his practice isn't about when it's happening, being reactive and helping. Obviously, if you're dealing with something that's serious, please do. But there's also that preventive training and basically being more empowered to take an active role in your health and your golden quality of life. So with that being said, thank you for joining us today, everybody. And thank you, Doctor, for being here. I will not even bump. I'm going to just say namaste to you.
That's right.
Yeah,
Namaste to you. And
or
Paul,
that.
we'll just Paul, thanks for always being a sport.
For always being the cranky old man in the room.
No, I appreciate that. You know what? Because there's a lot of you out there, and we just have, this is a reality show. So
That's right.
Thanks, everybody.
Thank
See
you.
you guys next week.
You have been listening to the Rad Life radio show with your host and age explorer, Rad Gantos, brought to you on the one and only octalkradio.net. Join us again next week as we continue our journey of discovery into life's challenges, opportunities, options, and all the latest and greatest things that come with getting older.